I'm Dr. Ikshita, consultant gynecologist, and you are watching Women's World 58. In the last episode, we discussed about decreased female libido, its causes, and with what symptom the patient comes to a gynecologist. Now, in today's episode, we are going to discuss what are the diagnostic criteria and how do we manage decreased female libido. So let's come to the diagnostic part of it. When a patient comes to me with the symptoms that she has no interest in sexual act, I take a detailed history such as whether she is suffering from diabetes, whether she is taking any anti-hypertensive medicines, or if she is taking oral contraceptive pills to avoid pregnancy, or she is a newly-wed mother she is a newly delivered mother who has delivered in the recent past, or whether she is taking any antidepressant medicines. So this history can lead us to so many causes which must have led to the decreased sexual libido. I examine the patient by doing a PV examination. In this, I try to assess whether she has any pelvic inflammatory disease, or she has uterine fibroids, or ovarian cysts, or any other condition which can lead to painful sexual intercourse. Now, once this examination is over, I carry out certain investigations on this patient. I will do her hemoglobin test to find out if she is anemic, because anemia leads to fatigue and that leads to decreased libido. Then I will do her blood sugar fasting and post-lunch blood sugar to rule out diabetes. Then I advise her to do a abdominal sonography. Sonography tells us many things, such as there is a presence of uterine fibroid which is large and which can lead to painful intercourse. If there is free fluid in the pelvis, that indicates she has infection and pelvic inflammatory disease. Whether she has ovarian cyst, ovarian tumor, or ovarian endometriosis. All these conditions can be diagnosed by doing a sonography. Now let us come to the important part of this discussion, that is the management. How can I give relief to this patient? If the investigations show any kind of medical disorder or a gynec disorder which needs surgery or medicines, then it will be treated accordingly. But if all these investigations are normal, and then how do we go about it? So for these patients, the main pillar of management is counseling. I call this patient for visits again and again and talk to her to remove the negative opinion or the negative feeling in her mind about the sexual act. Now, once I am successful in doing that, then I advise her lifestyle changes, such as doing regular exercise. Now, how exercise helps? Because of exercise, certain hormones called pheromones are secreted from our brain, and they bring a feeling of happiness, positive feeling in the mind, and then she feels energetic and she can overcome the problem of decreased libido. Another lifestyle changes is adequate sleep. Inadequate sleep leads to disturb melatonin secretion in the body and decrease libido. These days we see the young generation doing late night work up to 12 o'clock or 1 o'clock, or sometimes they are so busy on the social media that they almost forget to sleep. And when I take the history of my couples, how often they have relations, intercourse in a month, and they say maybe once a week or once in 2 weeks. So I advise this patient to have a bedtime routine, such as having dinner earlier, taking warm water bath before going to bed, putting a blue light in the bedroom and listening to soft romantic music. When she has adequate sleep, she feels happy, she's excited, and then her libido improves. Another lifestyle change is avoiding smoking, too much of coffee, too much of soda drinks, too much of alcohol. And nowadays the girls are doing strict severe dieting to lose weight. So that also can lead to psychological disturbance and decreased libido, and also they consume sugar substitutes such as aspartame. So aspartame also can lead to decreased libido. Now there are very important advice, like what are the food ingredients or what are the food items that I suggest to my patients which are proved to be beneficial. Now there is a herb called as shatavari, and in Ayurveda shatavari is called a female tonic, and it is also known to improve the female libido. Now it comes in the form of capsules or powders to be added to milk. Another important ingredient in our Indian cuisine is saffron. Saffron is known to increase hemoglobin synthesis, it is known to purify blood and also increases the libido. Now third thing is nuts such as pistachio. Fourth, ingredients in our kitchen such as garlic and fenugreek. So I advise my patient to include these two ingredients in their daily cuisine. Red wine in smaller quantities may increase libido, but I don't recommend drinking it. Other things which can improve libido are fruits such as watermelon, figs, strawberries and avocados. So friends, we have completed the discussion of management of a very important problem in the life of a married couple, that is decreased female libido. And once you treat them, the patients will always thank you for saving their married life and improving the quality of her life once she starts enjoying the sexual act and the pleasures of sexual act. If you like this video, please share it with your friends, your relatives, and subscribe to my channel Women's World 58 for new interesting topics. Your subscription will encourage me to make videos on your topics. We'll meet next time with new interesting discussions. Till then, be happy and take care of your health. Thank you.